Hello and welcome you all to my YouTube channel called the Rheuma Talks. So I am Dr. Navneet Kamath, consultant rheumatologist at CMC Vellore, currently working as an assistant professor in Department of Rheumatology at CMC Vellore. So let me begin with what is rheumatology. So rheumatology is basically not just bones and joints. Rheumatology basically is a multi-system autoimmune diseases that we treat. So it's not just about bones and joints. Okay, so let me tell you who is a qualified rheumatologist. So to qualify as a rheumatologist, you need to go through a long process, especially in a country like India. So first we have to finish MBBS, then we have to finish MD in internal medicine, and after that we have to do a DM rheumatology course, that is also another 3 years. So a qualified rheumatologist is one who has completed his MBBS, his MD, his DM, okay, or instead of DM you have another option called DNB also. And there are some people who practice rheumatology as after finishing MD medicine they do a fellowship course in various institutes, so they also do practice rheumatology to some extent. Yeah, and certified rheumatologist, the degree itself holds clinical immunology and rheumatology. Basically, we study the immune system, and once the immune system goes haywire, this will lead to the symptoms of rheumatological diseases. So clinical immunology and rheumatology is the degree that we get after completing your DM or your DRNB course in rheumatology. So let me tell you about what are the diseases that we treat as rheumatologists. As I already mentioned, rheumatology is not just bones and joints. So we treat a lot of diseases, lots and lots of diseases which come under rheumatology spectrum. So we deal with patients who from the time of birth till the time they die. So that is so much of a vast spectrum of diseases that we treat as rheumatologists. So from the childhood point of view, what are the diseases that we treat when a rheumatology patient is a child, for example? So we deal with something called primary immunodeficiency disorders, then we deal with autoinflammatory syndromes, then we deal with pediatric onset vasculitis, pediatric onset rheumatoid arthritis, systemic sclerosis, scleroderma, or inflammatory myositis. These are some of the diseases which can occur in the pediatric population also. So then coming to the adult onset diseases, we have again a huge spectrum of diseases that we treat as adult rheumatologists also. So those diseases we have a lot of classification for so many diseases, and the common ones we treat include the arthritis spectrum. So the so-called, the world famous word so-called Ghatia or the Sandivata is another a type of arthritis. In common man words, I would say it is as a गठिया का बीमारी है और संधिवाता बोला है डॉक्टर ने हमको. So these are the common words that people tend to use, but again arthritis is a huge, there are hundreds of diseases which presents like arthritis. So understanding each and everything is very important for a rheumatologist because treatment is going to be completely different. So the common arthritis as such that we treat is your rheumatoid arthritis, your spondyloarthritis, then IBD associated arthritis, which is your inflammatory bowel disease associated arthritis. Then we have reactive arthritis, then we have psoriatic arthritis also. Then we deal with one of the interesting spectrum of diseases that is called as connective tissue disorders. Connective tissue disorders basically includes your SLE, okay, then your Sjogren's syndrome, okay, recently it's called as Sjogren's disease, okay, then we see MCTD. MCTD is mixed connective tissue disease, okay, then we deal with something called IIM. IIM is idiopathic inflammatory myositis. That is also a very important disease that we treat. Sometimes it do overlaps with neurologist also, but if it is immune mediated, autoimmune mediated, usually we are the ones who treat this kind of diseases also. Then we have some interesting spectrum called as vasculitis spectrum. Vasculitis is a huge chunk of diseases that we as rheumatologists are qualified to treat because it's an extensive group of diseases with highly complicated presentations. Your vasculitis can include your large vessel vasculitis, it can be a medium vessel vasculitis, it can be a small vessel vasculitis. For example, in large vessel vasculitis you have something called your Takayasu arthritis. Okay, then you have something called GCA or a giant cell arthritis. Okay, these are large vessel vasculitis, for example. Then we have something called medium vessel vasculitis, which include your Kawasaki disease, which includes your polyarthritis nodosa. Then we have small vessel vasculitis, which can be your ANCA vasculitis or your anti-GBM disease or your immune complex mediated vasculitis. So these are just examples of vasculitis that we treat as a rheumatologist. Then we also deal with degenerative joint diseases. Degenerative joint diseases basically are, for example, your osteoarthritis that occurs usually in the elderly population. So this is the degenerative joint disease. Then another interesting spectrum that we deal with is your infiltrative disorders. Okay, something called, for example, your sarcoidosis, then your IgG4 related disease. These are your infiltrative disorders. Then histiocytic disorders. Okay, these are some of the example of infiltrative disorders that we treat as rheumatologists. Then we deal with patients who are having cancer also, because some cancers can come like rheumatological manifestations also. So that is also one spectrum that we deal with. Then we also deal with arthritis, which accompany your metabolic or endocrine disorders. So they also can come with many musculoskeletal manifestations, which can be very tricky to diagnose sometimes. Then another spectrum that we see commonly is your crystal arthritis. Crystal arthritis is basically deposition of any crystal into the joint or the synovium, for example, or in the cartilage. So that is, for example, we have gout. Gout is a very common, crystal arthritis that is seen in patients who are having high uric acid levels. Then we have CPPD disease. CPPD is calcium pyrophosphate deposition disorder. Okay, so that also is coming under your crystal arthritis also. Okay, so then another interesting set of cases that we see is treatment of cancer sometimes can trigger an autoimmune response that is called immune checkpoint inhibitor immune related adverse events, for example. Okay, so that is another spectrum that we deal. Usually we do get a lot of consults from medical oncology and hematology who use this immune checkpoint inhibitors for treatment of cancers. They also develop many rheumatological manifestations ranging from arthritis, myositis, then skin manifestations, lung involvement. Any autoimmune manifestation can happen. So overall, if you see, we deal with diseases that is a wide spectrum, right from the time of birth till from the time of the death of a person. Okay, it can involve any part of the body, right from your hair till the toenails. Okay, it can be from your hair till the toenails. Okay, it can be your joint, it can be your skin, it can be your muscle, it can be your lungs, it can be your heart, it can be your kidneys, it can be your intestines, it can be your liver, it can be your spleen. Basically any system of the body can be affected in rheumatological disease. That is very important to understand. So don't just think that rheumatologists are just to treat only for the bones and joints. Okay, and we are different from the orthopedicians actually. So don't get confused between a rheumatologist and a orthopedician. Orthopedician basically they have a degree in MBBS followed by a Master of Surgery in Orthopedics. We as rheumatologists, we go through a different route. After MBBS, we complete MD, then we do a DM or a DNB in rheumatology. So we are completely different from orthopedics. The diseases that we treat are completely different from orthopedics. So never get confused between a rheumatologist and your orthopedics. So choosing the right doctor, I think, is very, very important for better patient outcomes. So we have covered the list of diseases that we treat as a rheumatologist. So in my forthcoming videos, I will be explaining to you about each and every disease in detail, and what are the symptoms, what are the signs, and how do we diagnose and how do we treat these diseases, and what a common man must understand about rheumatology. So in my upcoming videos, I'll be busting a lot of myths about what is rheumatology and how we treat the diseases. So please like and subscribe to our channel.